sessions. Ms. Meda Balla, Assistant Professor at Amar Said Baba Ajit Singh Jujar Singh Memorial College of Pharmacy. Ms. Meda Balla is currently working as Assistant Professor in the Department of Pharmacology at Amar Said Baba Ajit Singh Jujar Singh Memorial College of Pharmacy, Bela. She is pursuing her PhD in Pharmaceutical Sciences. Her main research area are cardiology, neurology. She have over 3 years of teaching and research experience. Ms. Meda Bhalla has published 2 research papers in well-known journals and has written 1 book chapters with an international publisher. She has attended more than 35 seminars, conferences, workshops, and has presented her research or participated in over 10 nationals and international of events. She has also completed over 10 refreshers and short terms of courses to improve her skills. Ms. Medhavalla has received serve of award and recognitions for her work is an activity of members in the institutionals of innovations of council. I welcome to Madam to proceed of the your sessions.
Accidents, which can basically cause. Thank you, sir. Good afternoon to all. Hope you all are in good health. Welcome to this practical session on human anatomy and physiology. Today I will demonstrate on the neurological assessment, and while completing the neurological assessment, it is important to understand the functions that are basically performed by the nervous system. And by analyzing the nervous system, like for example, if there is a damage to a specific part of the brain that is caused by either head injury or some kind of that is cerebrovascular accidents like stroke and all, then there is a basically specific defects in the speech, facial movements, and extremities. And the damage to the spinal cord can cause various motor and sensory defects. So let us first discuss the learning objective of today's set demonstration. So by the end of this session, you will be able to learn how to perform neurological assessment in your labs. Next is learning objective that you will be able to document actions and observations that you can add on in your regular experimentation, and you can let your students study with that. Third is to recognize and report specific deviation from the normals. And so now let's start with the demonstration. I hope you all will enjoy it throughout. So the title of presentation is Demonstration of General Neurological Examination of and of olfactory nerves. Next is the neurological contents. The contents of this PPT are neurological assessment, introduction, aspects of neurological assessment, level of consciousness and Glasgow Coma scale, mental status examination, cerebral functions, olfactory nerve functions, motor functions, sensory functions, and in the last there will be demonstration on the motor, sensory, and cerebral functions. So let's start without any delay. So introduction, but neurological examinations are basically defined as the assessment of sensory neurons and the motor responses, especially the reflexes to demonstrate whether there is a nervous system impairment or not.
निकलो निकलो चालू नहीं कुछ भी चालू नहीं
Neurological physical examination are a very important tool in neurological diagnosis, and there are present many CT scans or MRI techniques which are advanced techniques. But the basic technique, the basic assessment is the history and the physical examination of the patient. The neurological demonstration is basically divided into two types. One is anatomical diagnosis and the other is etiological diagnosis. In
ये ले दो नीचे
it localizes the lesions that
निकलवा के पंडित जी को दे देना फिर यूज हो जाएगा
yeah, that is reflexes. Like you can take an example of cerebral hemisphere, like diencephalon, brainstem, and all these things. And next is the etiological diagnosis. In etiological diagnosis, it specifies the cause of lesion. And the etiological diagnosis basically specify focus on the cause of lesions. Then the time course of fitness to define the etiological agents that are responsible for the anatomical agents. The systemic examination that basically surveys information in the brain and the motor commands and impulses back to brain for processing and coordination. So this purpose of neurological assessment, there are four purposes that are basically served. First is to determine the presence or absence of any disease of nervous system like Parkinsonism, epilepsy, which you basically focus in pharmacology labs. No? And next is to identify which components of neurological systems are affected, like brainstem is affected, or spinal cord is affected, cerebrum is affected. Third is to determine the precise location of the problem. Like if some of the, like if we take an example of cerebrovascular accidents, like stroke, then stroke is basically a very large class. It is basically divided into focal and global stroke. So if we find the location of the stroke or the cerebrovascular accident, then we can proceed accordingly. Fourth is to screen the presence of discrete abnormalities in the patient at risk. So next is the aspect of neurological examination. There are basically 8 components in that. First is level of consciousness. Second is mental status examination. Third is special cerebral function. Fourth is cranial nerve functions. Fifth is motor functions. Sixth is sensory functions, cerebral functions, and reflexes. Please note down that in today's lecture, I will not focus on cranial nerve functions and reflexes. This will be covered in the upcoming lectures. Next is the level of consciousness. Basically, what is level of consciousness? It is basically defined as the best verbal or motor responses that can be elicited from patient to any kind of specific kind of responses. Like you can see in this diagram, the level of consciousness is basically divided into 5 types. First is alert, confused, lethargy, stupor, and coma. So, one by one, I will explain it. So, how you can define that your patient is alert? The alert patient is awake and responds immediately to the verbal stimuli. Whenever the patient is confused, the confused patient is awake and responds immediately, and it will not respond, or the patient will not respond immediately to the verbal stimuli. Next is lethargy. Lethargy is in the patient is drowsy and inattentive, but whenever any stimulus is made to the patient, that he is awake. Next is stupor. In this patient arouses with great difficulty and it does not cooperate with the examiner. Next is coma. In this coma, the patient loses his ability to respond to verbal or input stimuli, as in this no motor activity is seen. And in these things you all will see in the demonstration part that will be shown towards the end of this session. Next is the Next is the Glasgow Coma Scale. Now, as you can see in the basically Glasgow Coma Scale, this scaling is used by the neurologists and all the doctors. And you can also show this Glasgow Coma Scale to your students for analyzing the level of consciousness. Basically, level of consciousness in Glasgow Coma Scale is can be assessed by three parts. One is eye-opening. Like you can see in this diagram, if the patient basically directly respond to the stimulus and spontaneously open his eye, then he is given the scaling of 4. And if the patient responds to sound, then he or she is given scaling 3. Similarly with the verbal responses also and motor responses also. We can see downwards, it is written like the total numbers that the patient get is basically the numbering of the neurological defects. Like if the patient gets 3 to 8 numbers from this all this scaling, then this patient is having a major or severe neurological disorder. If the scaling is from 9 to 12, then it can be moderate. And if the patient scores 13 to 15 marks or the scaling, then it is a mild neurological disorder. Next is the mental status examination. In mental status examination, it is extremely important part of the neurological examination that is often overlooked. It should be assessed first in all the patients, and the mental status testing can be done in 5 types. That is level of alertness, or you can say level of consciousness, which you have already studied in the previous slide. Next is the focal cortical functioning, which you will study in the upcoming slides. Next is cognition, mood and effect, and thought patterns. The components of how you can assess the mental status of any patient or any subject. For this, you have to see all this, like general, what is the appearance of that subject? What is the speech, how the patient behaves or how he speaks? What is his thought process? What is his mood? Cognitive functions, attention, concentration, orientation, memory, general knowledge, abstract reasoning, judgment, and insights. For this examination, you can just play some games with the students to all these. Next is the special cerebral function. For special cerebral functions, they are basically assessed with 3 parts of neurological examination. One is agnosia, next is apraxia, and third is the aphasia. All these are focal cortical functioning. Like you see in the previous slide, I have mentioned that focal cortical stimulation we will study in the next slide. So first is agnosia. Agnosia is the meaning of agnosia is that the patient is incapable or unable to recognize the common objects. Okay, so basically, whenever the patient is having agnosia, then the association cortex and the temporal lobes and the dominant and non-dominant hemispheres are affected in that patient. Agnosia is basically divided into 4 types. That is anosognosia, which is denial of illness. Next is asomectosia, which is denial of half of its body. Next is prosopagnosia, which is incapability to recognize the faces. And last is extinction to double simultaneous stimulation. One very common example I'll give you, like if you will like if you are an examiner and you are getting a patient or subject, if you keep a mobile phone near that patient, you know, that he will not able to tell that it is a mobile phone. And if you will keep the mobile phone in the hands of the patient, then he will recognize the this is a mobile phone, and he will say that it is a mobile phone. Basically, what happens in agnosia is that his visual representation is disrupted because dominant and non-dominant hemispheres are affected. But his tactile functioning is active. Tactile means touch sensations. So this is all about agnosia. Now let's move to apraxia. Apraxia means it is a defect in the performance of complex motor tasks. Like the normal primary motor functions are assumed in this, Like, the areas that are affected in brain are association cortex, frontal lobes, both dominant and non-dominant hemispheres. And I'll give you some example that if you will ask the patient to show me how to salute, then that patient will not be able to salute you. Okay, so that means that there is possibility that there is a case of apraxia. Second is, and this kind of that example I showed you, showing how to salute, it is known as idiomotor apraxia. Next is ideation apraxia, in which the patient is unable to perform a series complex task. Like if you ask the patient to set the dining table for dinner, then he will not be able to perform that task. Next is constructional apraxia. And in this, the patient will not be able to complex any, not able to copy, sorry, any complex figures. Next is dressing apraxia. In this, the patient is not able to dress himself properly. Next is last is aphasia, which is the special cortical stimulus. In this, the six language functions are checked, and in this, the patient is unable to communicate. And the doctors basically check the fluency, how fluent the patient speaks, how fluent is the naming of the how he or he is able to name the particular object or name any particular person. What is his comprehension? How he comprehend anything? How he repeat any phrase or verb? Next is reading and writing. All these things are assessed in aphasia patients. Next is cranial nerve examination. Basically, as you have already studied, that there are 12 cranial nerves. And in this lecture today, we will focus on only first cranial nerve, that is the olfactory nerve. Okay? So, what is the aim? It is very easy, formation. In this, you have to demonstrate the function of olfactory nerve. All you need is an orange or a coffee or any other familiar order, like you can take chocolate or any other things you can take. And this subject is asked to occlude one nostril, like it is also shown in the diagram. While keeping his or her eye closed, and then examiner can take any of the substance as mentioned in the requirements. And then the examiner asks the subject to identify that substance by taking that one nostril occluded. And then the subject will tell that what kind of substance is that, what kind of stimulus he is getting. Now, the examiner can then repeat this experiment by taking other substances. Next is the motor function. In motor functions, basically, when while performing the motor examination on the patient with weakness, it is very important to remember that weakness could be result of any lesions in the body, in the cidal hemisphere, brain stem, spinal cord, inferior horn cells, peripheral nerves, neuromuscular junctions, or any muscle. Another important distinction in the evaluation of weakness that it is a motor, upper motor pattern, urine pattern, or a lower motor urine pattern. The motor examination consists of several parts like assessment of muscle bulk, evaluation of muscle tone, observation for spontaneous movements, functioning, and muscle strength. So all these muscle functions will be evaluated in the demonstration, that is muscle size for any symmetric atrophy and hypertrophy, muscle strength to assess the power of the muscle tone to assess the muscle tone with the passive or non-passive motions, muscle coordinations, gait and sensation, and the movements. Next is the sensory functions. Sensory assessment involves testing for touch, pain, vibrations, and discrimination. While when evaluating a patient with sensory dysfunction, it is very important to keep in mind all the level of nervous system at which the patient can produce a sensory dysfunction. And basically, sensory functions are disrupted whenever the peripheral nerve, lumbosacral plexus, nerve root, spinal cord, or you can say brain stem or cortex area is affected. And whenever you will examine the sensory functions, keep in mind that you will keep in mind this order, that is superficial sensation, deep sensation, and combined cortical sensation. If the superficial sensation is impaired, then it is for sure that there is an impairment in deep sensation and combined cortical sensation. And you have to also keep in mind that whenever you are testing the sensory perceptions, then you have to go from distal to the proximal direction. As I have already mentioned, the areas of the brain, sometimes diabetes mellitus, iron deficiencies, or other neurotoxins like DMT are also the major cause of the sensory disruptions. Next is the sensory examination. Sensory examination, this all will be shown in the demonstration of this. First, you will learn it. There are three types of sensory examination. One is superficial examination that was seen in the previous slide. Deep sensation and combined sensation. The superficial sensation for the pain perception, temperature awareness, touch awareness, and deep sensation for anesthesia awareness and vibration perception. And combined cortical sensation for stereognosis, tactile localization, two-point discrimination, double simultaneous stimulation, graphesthesia, recognition of texture, and diagnosis. So this was all about the theoretical session. Now let's move on to the practical demonstration. Hope you understand all the basic things that were taught to you. And now let's move on to the practical part. So hello everyone, welcome again. Welcome to the demo session on neurological functions. For this session, we need two subjects, subject 1 and subject 2. First of all, we will demonstrate the motor functions. Motor function assessment involves assessing muscle size, muscle strength, muscle tone, muscle coordination, gait and movements. There are many ways to organize neurological exam depending on clinical context and environment. So, step first, introduce yourself to the subject. Step 2, let the subject know the kind of examination that is done on him. His or her consent is very mandatory. Step 3, start with the modal examination for inspection of pronator drift power. Inspect the subject for general and limb postures. Look for any tremor, involuntary movements or fasciculations. Ask the subject to extend his or her arm and the palm facing towards ceiling. Hold his or her arm for 15 seconds and close your eyes. Note, this test has high sensitivity for detecting for muscle weakness due to motor neuron lesions in the corticospinal tracts. If the pronator drift is present, patient hand will pronate and the arm will drift downwards. As you can see in the demonstration, the subject 2 is having a pronator drift. Now move on to the next, tone. Tone is the amount of residual resistance offered by the muscle when it moves passively. Now assess tone in the upper limb by rotating the wrist and flexing and extending the elbow for constant stiffness. This indicates rigidity, spasticity, and flexibility. Next is power testing. To check for power, emphasis scaling is used. Grade 5, normal strength against full resistance. Grade 4, reduce strength against resistance. Grade 3, movement against gravity. Grade 2, movement when gravity is removed. Grade 1, flickering of movements in the muscle. Note the flickering of the muscle in the subject 1. Grade 0, no movement or paralysis. To test the muscle power, use systematic approach. Can you hold the arm like this and try to resist me? And now can you hold the arm like this and pull in? And now, will you try to push out like this? While testing the power, it is very important to isolate the muscle being tested. Note, always compare the muscle on both the sides. Now, can I ask you to extend your wrist like this? Now, flex your fingers. Note, while applying the pressure according to the muscle being examined and do not over-exaggerate the subject. Now, move on to the sensory functions. Sensory assessment involves testing for touch, pain, vibrations, and discrimination. A complex sensory examination is possible only if the patient is conscious and cooperative. During this examination, the patient or subject has to keep his or her eye closed throughout the test. Kindly see that subject 2 eye is closed and he or she is not able to see anything. The first test is the pain perception. It is also known as sharp or dull discrimination. To test this sensation, sharp or dull end of any object like safety pin or the cotton strap are used. The sharp and the dull end is randomly applied perpendicular to the skin. Ask the subject to raise a hand whenever he feels the sensation from the sharp object. Okay, so second test for sensory examination is the temperature awareness. 2 clinical flasks with the stopper are required for this examination. One is filled with cold water and one is filled with the warm water. Now, pick one conical flask and randomly place in the contact with the skin of subject 2. The patient or subject is asked to respond whenever he feels warm stimuli. Now, next test is the touch awareness. Piece of cotton and or toothbrush is used to perceive the tactile touch input. As I've already told that tactile means touch awareness. Light touch or stroke is applied in the area to be tested. Patient is asked to indicate if he or she recognizes the stimulus being applied. Subject can know. Now subject can open his or her eye. Thank you for your coordination. Now let's move on to the cerebral functions. For evaluation of balance, and coordination, these tests are basically used. The first test is finger-to-finger test. In this, it is basically performed by instructing the subject to place her index finger on the subject's first index finger, and the subject is asked to repeat this for several times in succession on both the sides. Very good. Next is finger to nose test. Both the subjects will perform this test. The subjects have to extend their finger and then touch the tip of their nose several times in rapid successions with both open and closed eyes. And the third test is a tandem walking test. This is tested by having the subject is due in the normal standing position. Then the subject is instructed to walk over the heels on the straight line. Unsteadiness, lurching, or broadening of gait is observed in the subject 1. As you can see in this demonstration, the subject 1 is not able to walk properly. So that's all about the cerebral functions. Now let's move on to the other sensory function. This is the kinesthesia assessment. Kinesthesia can be evaluated by moving one arm of the subject and ask the patient to move the other arm by themselves. Now, subject is asked to close the eyes and now repeat the similar movements. Kinesthesia is the ability to sense that provide information about the position of the body in space and how we move respectively. Thank you so much. That's all about the sensory, motor, and cerebral functions. Let's do check the neurological examination. Thank you.
Thank you very much, Ms. Meda Madam, for your enriched and details of sessions on the nervous system practicals. Your insights were extremely clear and helpful. Now I request to all participants to interact with the today resource persons and ask any doubt regarding of this topic. Now all are unmute. If you have any queries, any questions, please ask to the resource person. Okay, now thank you to all of you.
So after this session, we are sharing the feedback of the both resource person. So please do the fill feedback form. So we will try to better the upcoming session. Thank you.